It's Monday, August 30th, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to look at an article that comes to us from Brazil and was accepted in 2021. This article is entitled "The Main Uses of Ozone Therapy in Diseases of Large Animals, a Review." So hopefully you have some questions about ozone and large animals and how to use it, etc. We're going to look at a bit of information here, but I just wanted to clarify there's a lot at the beginning that talks about how ozone therapy works. We're not going to get into the nuts and bolts there. If you want to look more in depth on that, you can download the study and take a look on your own time. I will read this. It says the purpose of repeated ozone administration is to create resistance against oxidative stress through the stimulation of the antioxidant system. Therefore, medicinal ozone is considered a prodrug since its byproducts are responsible for biological effects on the animal organism. So a prodrug is metabolized by the body and it produces a drug within the body, basically. But the prodrug itself does not create those changes. It's the biological processes that create the change in the body. And that's really what ozone is doing, is stimulating different biological processes to take place, which then help to heal us and our pets. So we're not going to talk about ROSs or hydrogen peroxide or 4-HNE signaling, NRF2, immunomodulation, antimicrobial effects, wound healing, all that stuff. You've heard, we've talked about it before. It's in here. Oops. But it's not something we're going to focus on. There's this cool little graphic that you can see how ozone is introduced and then what the downstream effects of that ozone are on the patient, generally speaking. So take a look at that if you'd like, again, on your own time. I wanted to jump into use in large animals. We're going to start with uterine infections. Those of you who are treating large animals, uterine infections are a big deal. That's a big problem. It says ozone therapy has already been shown to be effective in resolving different reproductive infections, whether in ruminants or horses. The benefits of intrauterine application of medical ozone are due to the fact that it improves the uterine environment, oxygenation, and tissue perfusion, among other things. But so they go on and say ozone can be used prophylactically to increase the chance of fertility in cows and horses, etc. So that's one use for it. But also, as mentioned right here, in these cases, uterine infection with endometritis, uterine lavage with ozonated fluid has proven to be as or more effective than conventional treatment. So ozonating 500 mLs to a liter of fluid and lavaging the uterus is a great way to go. Excuse me. Mastitis. Ozone therapy has been used successfully in the treatment of mastitis in large animals, has a great advantage because of the fact that it does not leave residue in the milk and need to be discarded then. Here's a little bit of information about how they did it, different concentrations, what was used, the volume, treatment frequency. You can take a look at that, maybe hit pause right now and take a look at that. We're going to jet on by. Urovagina. That's another area where ozone has been used successfully to increase the opportunity or the likelihood of insemination and pregnancy being successful, and after surgery to accelerate healing. Now, this is from Dr. Kalin in Romania. So that's cool. We've had him on our summit. This is one of the studies he did, successfully treating 5 horses with infected wounds. So this is ozone bagging. They had some great results from all of that. 50 micrograms per milliliter, 30 minutes a day, every 3 days. So that's another way it can be used in wounds. Osteomuscular diseases. Ozone therapy has been successfully used to treat muscle, tendon, and joint disorders in both human and veterinary medicine. And we've talked about that as well before. Foot disease. Ozone therapy is an excellent alternative treatment for cases of laminitis, showing effectiveness in several studies. Limb bagging would probably be the method of treatment there. The techniques used were intravenous application of distilled ozonated water and major autohemotherapy. In some cases, In these cases, the application of the O2-O3 mixture acts in different ways, having anti-inflammatory uses, foot rot as well. So there's various ways it can be applied. Some of the ways that we see it used most in treatments like this are limb bagging, but you can choose other methods, IV application, as well as systemic methods to treat, as well as local methods. Used in eye infections is another way that it can be used, so don't overlook that. Well, that is actually all of the time we have, all of the information we have to give to you today. We hope this has been helpful.